minute. When I asked for 5 mils, they didn't even know what
it's okay. It's that minor.
Even if you share a flute with someone else, that's like a smoking.
There wasn't so much focus on on prevention and harm reduction 20 years ago or whatever. Now there is obviously a lot more. But back then there just wasn't anything remotely like there is now.
I've always seen drug use as a phase for the majority of people. It's a phase that most people go through and come out the other end. Our responsibility is to get them to the other side of the phase safely.
In the late 1980s, in response to the HIV epidemic, Substance Misuse Services introduced a more pragmatic approach to reduce the harms that use of legal and illegal drugs causes to the health of the individual and the community. As part of this approach, services developed needle exchanges, providing a direct means of reducing the risk of transmission of bloodborne viral infection, specifically HIV, hepatitis C and hepatitis B, caused by sharing of injecting equipment.
It's about immunisation against hepatitis B, hepatitis A. It's about advising them about the ways in which they can avoid hepatitis C and HIV. It's about safe sex, and it's about safer use of drugs. All of those things as a package is an essential part of harm minimisation. And needle exchange often is in a good place to provide the vast majority of that.
The Welsh Assembly Government implemented a substance misuse strategy entitled Working Together to Reduce Harm 2008 to 2018. This film aims to establish how one key area of the strategy, that of needle exchange service provision, is working in reality. We interviewed service users and providers from across Wales on a range of issues that are identified as best practice within national public health guidance and the Welsh Assembly Government strategy and core standards.
I think it's crucial that we have a range of services, so both pharmacy-based and specialist needle exchange services. With specialist needle exchange services, you have staff there who are able to provide extensive harm reduction information, to assess needle injection site injuries, to provide signposting and referral into other agencies. But with the pharmacy-based services, we get coverage.
Yeah, I do use both services, the van and the pharmacy, because the van's only here twice a week.
Luckily enough, I live in town, but in the villages, you know, I've heard it's hard to get needles and whatnot, you know what I mean?
My local chemist they do packs, but that's my local chemist. It's somewhere where I've grown up, and you know, I don't really want to use that.
Years ago, you could go in into a chemist or into Boots or into other places and pick up needles, and it'd be so much easier. And so, because then you wouldn't have to go using the same pin. It'd be easier basically if it was spread out a little bit more, so you wouldn't have that problem.
An outreach kind of service, that would be pretty good, because then you can't get much more flexible than that, you know, when it's effectively taking the service out to the users and things like that. The more services that are available, obviously the better that'll be for service users.
Well, we have one worker who tends to be vulnerable families in the home, so that it could be a mother with children who can't get down to get their needles to go. It's also users who never come to an exchange. It's another service that goes out into the community, so that you know, a relationship is built up there that in turn can entice people into services.
I get them 7 days a week in town now, yeah.
because you can get them from Boots.
3 inner city pharmacies have pulled out from the scheme, the needle exchange scheme, which the impact on clients mainly is that after we close, which it happens for, and of course the impact again on weekends. There's no service in the city centre.
Got to be there by a certain time to get them, and then if you're not there, then you miss out. And then that's how people catches it, tightness and share and stuff.
Yeah, I'd like to see longer hours basically, and not this kind of thing all the time that, you know, it's 9 till 5.
They're trying to get some sort of cover for the weekend, which I say is definitely needed.
They had one late evening and one by me, and I found that actually really helpful because I used to work 9 to 5, and with it being open from, I think it was till 6:30 or 7, not particularly really late, but that was actually really helpful for me, really helpful for me. So I think something like that would be helpful again.
And I've put it in a public bin in the past, yeah. But that's because I'm homeless and I've got nowhere to, you know, keep them.
The best thing a council can do is like put like, you know, little boxes around so people can put them in and stuff. But because there's none of that around, you know, because that's why they're chucking them and stuff, you know, because they haven't got nowhere else to put them.
Yeah, from the needle exchange, yeah. They did used to supply ampoules of water, which were very handy, but they don't do that anymore.
On the weekend, you go to Boots and you gotta get naked. And it's like, they only give you 3 pins and swabs. But you need citric and you need a cooker.
They've started giving citric packets out, but sometimes they're there, sometimes they're not there. It just depends on what day it is. Vinegar for citric acid, lemon, petal descaler, anything that works basically.
I will probably use what I've already got, maybe an old pin and an old spoon or something of mine which I put in the bin. I may reopen the bin and use that again.
People are reusing a lot. I admit it, I've reused a lot myself.
If you just want 5 needles, you want 5 pots, you maybe want 5 citrics, 5 swabs, then the needle exchange van will do that. You go to the chemist and they'll give you a pack. But in that pack they'll give you 20 syringes, only 2 pots. So you do the maths, you've got 20 pins, 2 pots, so you're going to have to reuse your pot again and again 10 times over.
Oh, 10 pins, but I only need 2. It's a thought in my head, I'm thinking, oh, I got 10 pins now, you know, I only need 2. But I'll go on, I'll go and buy more gear, do you know what I mean?
Like Boots, I think, they only allow you so many in Boots. When I've been there, I've asked for 3 packs of 1 mils and there's like 15 in a pack, used to be 10, but now it's 50. You can only have 2.
Yeah, if you don't take your return, they just give you an emergency pack, which is 1 mil syringes, and if you're using your groin, for instance, you need longer needles in. So sometimes you have to go outside, put the new ones into a bin, and then take the bin back in, and then they'll give you a steroid pack, you know, which is a bit pointless, really.
And if you don't take a dead man back to put in, you don't have them. They won't give them to you. It's ridiculous. This is why so many people are sharing needles.
There's a lot of different things that are involved in injecting. It's not just sticking a needle in the vein and that's it, is it? There's a lot of things involved around it, so.
If you come to the drop-in and you can see one of the staff, if you're having a problem with sight, you know, then they can help you and see with the chemist it's over the cancer, and you know, there's people coming in and out, and so it's obviously you can't do it.
Really, as far as giving information about safer injecting bloodborne viruses, it tends to be mostly in a leaflet basis, and probably in all honesty most pharmacies would only find time to be able to do it that way, but it is helpful obviously if that verbal information is there to back it up and make sure the person understands what's contained in it.
I had a good chat when we first met them, and they, you know, all the stuff that I was worried about, they told me. It's all about keeping it between you and your own need, and not with anybody else, and don't let anybody else inject you, because that's how you get your viruses going and all the rest.
You know, I know people that are like got arms that are just limp through injecting. Now, if they knew what they were doing, that would never have happened, yeah.
But we are able to signpost them to other services in the area if we feel we haven't got the expertise, so that's quite important.
It was an abscess, and I showed it to one of the staff, and they said get to hospital straight away. If they weren't in, I didn't get the advice off the staff member I spoke to, then there's a good chance I would have left it, I would have lost my hand.
They do vaccinations for hepatitis B, which I've had. Yeah, you can access other stuff from them.
The harm reduction van helped me a hell of a lot. When I first started going there, I was a heavy user. I was using all the time, like, you know what I mean? Well, they helped me get on a script, got appointments for me in the gun clinic to go and get tested, blood tests and all that, do you know what I mean? To see if I was clean and all things like that. And yeah, it's good, do you know what I mean, to go there and they treat you like a normal person, do you know what I mean? You see a lot of people on the streets and they knew that you're picking up pins, like, do you know what I mean? And they'd look at you like you're a piece of scum, but you can go there, you get your pins, you have a coffee, do you know what I mean? Have a fag, talk to them, do you know what I mean? And it's pretty good, like, do you know what I mean?
Actually went to the chemist myself probably about 6 months ago, but they make you feel uncomfortable getting them, throwing them at the counter at you, making you stand there. It's not a nice feeling.
I've been to a few needle exchanges and, you know, down the southwest, Bristol, Taunton, Minehead, Newport, Cardiff, you know, but most of them just give you the pins and just basically that's you got your stuff like out the door now. What else do you want? Like, you know, what are you still here for? But the guy who's at this particular one, he's a really helpful guy, like, you know.
It is that thing of engagement, and it is from the client's point of view, which it has to be the most important thing. They do like to see the same person. They do like to know what they're walking into and what they're going to have.
She's the only one I go to. She's really friendly, and she's always got a smile on her face anyway, and she always got a tin of sweets as well. So
I think between needle exchanges run by drug projects and pharmacy, I think there needs to be a better connection, more networking, I think, between pharmacists, pharmacist staff and needle exchange workers in general.
I think it'd be a really good idea if pharmacies could train with drugs agencies as well. So we're very fortunate that we are able to do that on a lot of occasions, but that's because we're quite active in the service anyway, and perhaps those who are less active in the service are actually the ones that need the training.
What would happen if the car manufacturers didn't listen to the people who bought their cars? You know, they'd be making some right, wouldn't they? You know, and it's the same kind of principle, and you know, you've got to listen to the people who use your service. It's the same in business, isn't it? If you listen to the people who buy your product, you know, if you want to put it like that.
Ongoing evaluation has clearly shown this public health intervention to be both effective and cost efficient. These services may represent the first or only contact drug users may have with a service relating to their drug use. As such, their importance cannot be overstated, and support for them must not be undermined.